Dr. Alemu, thank you for taking the time with me today.
Thank you.
Excited to hear about where you're at with TQIntelligence. My understanding is that you have a really novel approach to applying voice technology to healthcare. So just break that down for me. What have you built?
Yeah, glad to be here. So what we do is we take about a 60-second or less voice sample and quantify the severity of the psychiatric symptoms. So these are for children, adolescents who are going through mental health treatment. So what we do is we support the providers in 4 different ways. One is we quantify the severity as quickly as possible. 2, we help them track progress or changes in terms of the symptomology as they go through the treatment process. The third one is you monitor symptoms outside of treatment, remote monitoring for kids that are high risk. And finally, we support the providers in automating the documentation process. That is a pretty significant burden on mental health providers as a whole.
So walk me through a typical patient encounter that involves this technology. We're talking about sort of front door intake. We're talking about in a psychologist's office.
Yeah.
How does this work?
Yeah, so there's multiple ways that patients come through services. In the focus that we have right now in the publicly funded system, these are kids from low-income communities. The services are provided in the home or at school or remotely. Right? So more kind of a natural environment. So we train the psychotherapists that work with the specific child. They take about 3-4 minutes collecting data. So that includes collecting the voice sample. We collect the PHQ-9. We measure the adverse childhood experiences that are very essential, kind of getting a baseline in terms of the trauma. And then another instrument that we use called the SFSS, and that have a parent version. So we want to make sure that parents are involved in the treatment as quickly as possible. As soon as they hit submit, collecting that data, we give them feedback in real time. And that feedback are used to drive the treatment process. As whether you be a psychiatrist doing telemental health services, right? These feedbacks will come in. So as you proceed through the treatment, so you can see whether the medication that you prescribed 4 weeks ago is making a difference, right? If the child has been in treatment for 60 days or more, right? We measure this. So the thing that we do really well is that we measure systematically.
Got it. Now you're coming at this as a psychologist who's specialized in children and adolescents. Can you think of a time when, in the past, when you wished you had a tool like this?
Yeah. In fact, I left my last job because of this.
Wow.
So I was running an agency, about 4,000 patients. There's about 200 providers. We just didn't have a way of systematically measuring what's going on with the people that we provide services. We get anecdotal, like testimonies, which is not a substitute for data, but there is currently, there's very limited data infrastructure to collect quality data, and even very limited collecting objective data as we do with voice, right? So this is an ongoing problem as it relates to mental health care. We don't see it changing for the foreseeable future. In fact, despite increasing access because of COVID and telemental health services, the quality of service, there's no evidence that the quality of service have changed, right? And then we're in a place now we're going to be short about 225,000 therapists by 2025. Areas that have difficulty attracting therapists before, inner cities and rural areas, would be particularly devastated, right? So what we're trying to do is what we call intelligent augmentation, right? Can we leverage AI and technology to be able to do things to support therapists at the time of care, right? And so the quantifying, the tracking, the documentation, while it improves outcomes, reduce cost, it also supports this pending shortage. And we want to just to give you an example, therapists spend about 40% of their time on documentation. That's 2 days out of the 5 days. And so if we save that one day by cutting the time down to their documentation by one day, that one day could have a significant impact, their ability to be able to provide clinical services rather than this mundane work of documentation.
You're really kind of on the leading edge of this, voice tech in healthcare movement, which we're seeing more and more of.
Yeah.
Where do you see this sector going for health? Where would you like us to be 5 years from now in terms of applying voice tech to health?
Yeah. So right now, the kind of voice analytics that we do, the speech and motion recognition is an emerging science, right? So what we really want to see it is this service plugged into smart speakers, for example, right? So rather than we are tracking kids who are going through the treatment process, can we identify problems early on? So I have a couple of them in my house. Most people have them, in their house. Can we make it available, for example, for parents to determine, right, how stressed is the kid, right? Stress is one of the core components of mental health issues, right? So if we can identify it proactively, right, and then if we can be able to support both the kid and the parent before things are getting, so you look at right now, 1 in 4 kids having, COVID has created a situation that is much worse, right? School systems and parents are completely overwhelmed by the trauma that COVID created. So if we can provide a way for them to be able to measure the level of stress and then communicate that, right? Kids don't tell you what's going on. I have 2 of them, right? They're reluctant to tell you what's really going on. So if we use an objective measure like voice, right? And then with all the privacy and security and consent, right? If we make that data available in multiple settings, I think we can make a dent in the mental health crisis that we are experiencing currently, not just for adults. Children and adolescents are the most impacted when it comes to what COVID did in terms of their mental well-being.
And just to clarify, you're talking about being able to use voice technology to pull mental health data out of how you're speaking, not necessarily what you're saying.
That's right.
It's not just the fact that I'm recording myself saying I'm stressed.
That's right.
You're detecting the stress and I'm answering a different question.
Yeah, absolutely. We don't really care for content.
Yeah.
Right? Content continues to be highly subjective.
Yeah.
What we care for is there are these idiosyncratic nuance changes in the voice that happens when someone is experiencing trauma or stress.
And you can detect that with your algorithm.
Trauma and stress are primarily a physiological experiences, right? You have a net cardiovascular activity that impacts how you speak and what kind of speed or not speed that you use, right? And trauma also impacts 3 critical areas of the brain. One has to do with the prefrontal cortex, the ability to be able to participate in pro-social activities. Right? It impacts the amygdala, which the way that people manage emotions. It impacts the hippocampus, learning memory, right? So if you have a child with a history of trauma, right, there's 3 key areas of your brain that you need for learning, developing your relationship, and being productive are impacted by that. So what we do is we want to measure that objectively and make that data available, support providers so they can provide aggressive intervention so we can avoid a lifelong consequences that we know is terrible.
That's awesome. Dr. Alemu, thank you for taking the time with me today. I appreciate how you've taken your experience helping children and funneled it into this technology so that you can scale it so much bigger and help more kids. So I wish you all the best.
And we're glad to be a part of the StartUpHealth family.
Awesome.
Yeah.
Thank you.
Thank you so much.
Take care.
Cool.